If you or your loved one is having recurrent attacks of nausea, vomiting, and someone has mentioned the possibility of either cyclic vomiting or cannabinoid hyperemesis, then listen to this. If hot showers are the only thing that relieves your symptoms, this is a huge clue that can lead to a potential diagnosis that often goes unrecognized for months, if not years. I'm Dr. Matthew Glover. I'm a clinical gastroenterologist out in Las Vegas, Nevada, and I have a multitude of patients in my clinic with either some combination of cyclic vomiting or cannabinoid hyperemesis overlay. In this video, I'm going to share 7 practical tips to help differentiate cyclic vomiting from cannabinoid hyperemesis. But first, let's start with some quick definitions. Cyclic vomiting is most commonly defined as stereotypical attacks that have a close association with migraine biology, social stressors, certain food triggers, or sleep deprivation. There's also a complete return to normalcy between these attacks. The patients are normal except for their acute attacks of nausea, vomiting. Cannabinoid hyperemesis, on the other hand, is increasing severity of attacks over time with a close link to chronic cannabis and THC exposure. Difference number 1, what is the clinical response to hot showers? In cannabinoid hyperemesis, patients often tell me in clinic that hot showers are the only thing that will relieve their nausea, vomiting. Sometimes it's to the point where individuals are taking multiple hot showers or baths during the day when an attack is happening. My patients will tell me this is the only thing that helps. In cyclic vomiting syndrome, you can feel awful and try anything, but the clinical response to compulsive hot water bathing is much more characteristic of cannabinoid hyperemesis. Number 2, cannabis exposure. Cannabinoid hyperemesis, as the name would suggest, requires some chronic cannabis or THC exposure. This is usually increasingly frequent over time. My patients often tell me, however, that Dr. Glover, cannabis is the only thing that helps relieve my symptoms, and this may be true. However, over the long term, cannabis can propagate and even be at the root cause of the problem. And this is what makes it so difficult to quit in many circumstances, because when you stop, you're going to get worse before you get better. If you don't use THC in any form at all, then cannabinoid hyperemesis is essentially off the table. But if you use THC regularly in any form, whether it be flower, edibles, vape, even Delta 8, cannabinoid hyperemesis is a real possibility. Number 3, what is the clinical response when THC stops? With cannabinoid hyperemesis, the pattern is that symptoms typically improve with complete cessation of THC. We're not talking about switching to edibles or using Delta 8 instead of Delta 9, complete cessation. However, improvement is not always overnight, and this is because THC is absorbed into your fat stores. So as you quit, your body's still metabolizing fat and releasing THC. This can go on for weeks or even months. This is why it can take some time to see improvement even after complete THC cessation. But if someone completely quits and the cycle stops, this is strong evidence that it's probably cannabinoid hyperemesis. This is opposed to cyclic vomiting, where even if THC is stopped, nothing changes because THC was not the primary driver to begin with. And just to be clear, cutting back does not count as complete cessation. THC in any form, whether it be edibles, vapes, can drive the cannabinoid hyperemesis syndrome. It's often true, and I tell my patients this, I'm not here to judge you, okay? My only goal is to get you better and to find out exactly what's going on. Number 4, what is the style of the episodes? Cyclic vomiting tends to be more stereotyped-like pattern, meaning there's the same onset, duration, and relieving factors. There is a similar pattern each time. And then the patients return to baseline for some weeks to months between the attacks. We say there is an intervening period of normalcy. My patients often say it's like the same storm over and over again. Cannabinoid hyperemesis can cycle too, but it's much more common to have simply increasing severity and frequency over time associated with ongoing or increasing cannabis or THC use. The attacks become more frequent, longer in duration, and they become more severe. The pattern becomes harder and harder to break. Number 5, migraine connection. Cyclic vomiting has a strong association with migraine biology. We often like to think of cyclic vomiting as simply an abdominal migraine equivalent. Most patients report a history of migraines, a family history of migraines, or even a history of other neurologic problems like motion sickness as a child. Cannabinoid hyperemesis does not necessarily require a migraine history. Yes, you can have both, but if there's a migraine history there, this is a strong indicator of perhaps cyclic vomiting over cannabinoid hyperemesis. Number 6. What are the triggers? Cyclic vomiting syndrome often has clear triggers. We're talking about things like infection, social stressors, menstrual cycles. Many of my female patients with cyclic vomiting report catamenial-like symptoms, meaning that their attacks happen every month during their menstrual cycle. Other factors can be sleep deprivation or even certain foods. Cannabinoid hyperemesis is more tied to THC use, often in the background. Episodes can feel like they come on spontaneously or correlate to more heavy THC use. Number 7, what is the clinical response to typical nausea medications? In cyclic vomiting syndrome, there is a much more reliable and predictable response to standard treatment protocol. Symptoms tend to improve with fluid resuscitation, antiemetics, or even migraine-like medications. All these treatments help to reduce the length and severity of an attack. In cannabinoid hyperemesis, my patients often tell me that there is minimal, if any, response to these standard treatments. And the only thing that helps is a hot shower until the ultimate fix, that is, stopping THC completely. So what should you do with this information? If you use THC regularly and cannabinoid hyperemesis is on the table, it's a possibility, I would strongly recommend a complete THC cessation trial. Completely stop for at least a couple weeks to months. See if the cycles of nausea vomiting improve with THC cessation. If they do, that's a strong indicator, and we're likely dealing with cannabinoid hyperemesis. One of the biggest problems we come across in clinic, like we talked about, because THC does help, in the short term, you may get worse before you get better, but don't let that stop you from doing a complete THC cessation trial. If you don't use THC, or your attacks have strong migraine-like features, then definitely consider cyclic vomiting syndrome, and either way, these recurrent intractable nausea vomiting attacks can have a terrible toll on your life, so don't self-diagnose forever. In the next video, I'm going to answer the biggest question of all, the most common question, and that is, how long after quitting THC does cannabinoid hyperemesis take to improve, and what should you expect? I hope you found this useful, and let me know in the comments below. Do you think it's cyclic vomiting or cannabinoid hyperemesis, or maybe you're not sure yet?